September is National Rehabilitation Awareness Month, a chance to highlight the importance of physical therapy and to recognize the rehab professionals who help get us all back on our feet. Here to help us learn more about rehab are Dr. Mark Ross and Renee Barrow from One Brooklyn Health. Welcome, gentlemen.
Thank you. Great to be here.
Renee, let's start with you. Let's talk about the big picture. Tell us a little bit about what is PT exactly and who needs it?
Yes. So physical therapists actually receive specialized training, and they can assist in the treatment of newborns all the way to the geriatric population and everyone in between. There was a study that was done in March of this year, in where 1,000 Americans, 51% received some form of therapy within their lifetime, whether it was in their home, in the hospital, in the nursing homes, acute rehab facilities, and in other outpatient rehab centers.
And what are some of the benefits of receiving physical therapy?
Yes. For the younger population and our weekend warriors, many are injured from these sports activities, and we deal with a lot of back pain, shoulder pain, and the aches and pains of our bodies. For the older population, many are injured because of the wear and tear of our bodies over time. Many receive surgeries such as total hip replacement and knee replacements. And there are other populations as well of our patients that experience traumatic events such as stroke, motor vehicle accidents, and encountering other neurological issues, and where they need therapy to get back to their daily living.
When we talk about rehab and therapy, we talk about physical therapy, but there's also occupational therapy, speech-language pathology. Can you tell us a little bit about those?
Yes.
Yes. Not only do we have physical therapy that really works on mobility for a patient and improving quality of life, we also have occupational therapy. Occupational therapists are like physical therapists. They get similar training. However, in addition to mobility, they'll work on activities of daily living for our clients. So they'll improve upper and lower body dressing, grooming, hygiene. They also work on fine motor training for our patients, as well as some cognitive training to improve memory, short-term and long-term. In addition, we have speech-language pathologists who will work on swallowing for patients, as well as for aphasias or difficulty speaking, and coming up with ways to communicate with the patient.
And Dr. Ross, can you tell me a little bit about some of the professionals that do therapies, all kinds of rehab at One Brooklyn Health?
Well, at One Brooklyn Health, so it's 3 campuses. We do have physical therapists, we have occupational therapists, speech and language pathologists. We also have one of the oldest residency training program for the training of the physicians, and it's called physiatry or physiatry. And they will help patients improve their functional ability and quality of life as with patients who may have functional impairments and pain.
Yeah. A lot of times I think people, they'll get a diagnosis, they'll have an acute problem, they'll see a doctor, but they maybe don't see their physical therapy all the way through. They don't stick with it as long as they should. What would you say to those patients out there to get them to maybe keep coming back for all those sessions?
Well, if you look at patients in general, the non-compliance of taking medication approaches 50%, and the more medications one has, the more you're non-compliant. The same thing holds true patients receiving therapy. They get the therapy, they partner with the therapist, and they feel better. So what do? They stop the therapy. And a lot of the therapy is really done at home. It's not the 45 minutes twice a week that coming to get the therapy that makes a difference. It's actually doing your homework on the other days that you're not there. So we try to partner with patients. We know we're going to be there with them, and it's a team approach, and we try to approach that with the patient, and we don't give up on the patient.
The bottom line is stick with it. Do those exercises at home. It will pay off.
Yes.
Exactly.
Thank you both so much for being with us today. If you want to learn more about why rehabilitation is such an important part of your long-term wellness and the services offered by One Brooklyn Health, scan that QR code on your screen or visit Pix11.com and click on the Pix Partners tab.